Hi, my name is Sena Debia. I'm doing a bachelor's of kinesiology with a major in health promotion, and I had the opportunity to do my fieldwork placement with the Public Health Association of Australia in Canberra, Australian Capital Territory. KHA is the principal NGO for public health in Australia, meaning they are a recognized voice in discussions on a broad range of health issues. Working with all levels of government, PHAA seeks to better population health outcomes based on prevention, social determinants of health, and equity principles. I worked with a policy and communications team whose main responsibilities are related to capacity building, advocacy, and policy development. My special project focused on developing a methodology to measure and evaluate the impact of PHAA submissions to government inquiries and consultations. I chose to examine policy advocacy in my placement in order to gain a deeper understanding of the interrelatedness of public systems and how different professions and activities contribute to improving the health system. While I expected that my project would be similar to other research assignments, during my time with PHAA, I engaged in in-depth analysis of policy issues, professional collaboration, and hands-on advocacy activities that made my experience a resounding success. I spent the first month of my placement learning about the policy development process and advocacy in the health sector. I reviewed literature and existing frameworks for analyzing advocacy, attended parliamentary panels, and reached out to public health professionals. I worked with my supervisor, Dr. Ingrid Johnston, and the entire PHAA policy team to identify evaluation criteria based on what tangible and intangible inputs go into influencing policy decisions in the submission process, and from there created my methodology. I presented this methodology first to the national office and then again to the general public on behalf of PHAA. I concluded my project by creating a simple, functional tool for PHAA, as well as a literature review on evaluating policy advocacy. These organizational resources will be used by future PHAA interns to continue to refine this methodology and investigate the gap between policy advocacy and influence. My findings will also be passed on to Dr. Catherine Cullerton, a research fellow at the University of Queensland School of Public Health, for a master's thesis project. Further, Ingrid, Catherine, and I are collaborating on an editorial looking at evaluating advocacy in the policy space to share with other advocacy organizations through the Australian and New Zealand Journal of Public Health. My practice in research, planning, and advocacy enhanced my analytical skills and provided me with valuable experience in the public health field. Learning about the policy development process and gaining insight into the cultural and conceptual context of public health also answered many of my questions about how I can shape the health system in my future career.